Okay, coracoid process here. What is the name of this bony piece? Chromium. What's that ligament? Coracochromial. What's the name of that ligament? Coracoclavicular. Good. All right. So this is the pectoralis minor, rib 3, 4, and 5 to the coracoid process, and they both get innervation from what we call the pectoral nerves. Now, at some point I have to stop with the crazy, and this is one of those times, because you can see, if you look at this picture, you can see that the pectoral nerves get information from both the lateral and the medial cord. See that? Okay, so I'm happy that you can remember the pectoralis major and minor get pectoral innervation. That'll be good at this point. So you've picked up dorsal scapular, subscapular, thoracodorsal, long thoracic, and the pectorals. And all the other ones, I hooked it to one place. And I'm happy if you can remember either of these for lateral, medial, pectoral. Their names tip you off for it, right? One comes from the lateral cord, one comes from the medial cord. All right. Now, the brachialis here, so we go back over here to the arm before we work our way down to the forearm. Does it surprise you to see that the brachialis here gets innervation by the musculocutaneous? No. This is flexion, right? That's musculocutaneous job, flexion. So can you name the muscles that you've seen so far that get musculocutaneous information?
The bicep.
Bicep, okay? Bicep has two heads. Attachment, short head to the coracoid process, long head to the rim of the glenoid cavity. Another muscle attached to the coracoid process and goes to the brachium called, from the coracoid process to the humerus, the coracobrachialis. And now this muscle deep to the bicep we call the brachialis. Now, the bicep is attached to the radial tuberosity. It's on the radius. That bone is lateral. Yes? Where is the radial tuberosity on the radius? Is it on the medial side of the bone or the lateral side of the bone? It's on the medial side. Yeah. So this muscle attaches very close to that. It is actually attached to the coronoid process of the ulna. So in the anatomical position, the trochlea, the trochlear notches around the trochlea on the ulna. The olecranon is behind you. The coronoid is the one that sticks up in the front. The coronoid and the radial tuberosity are right next to each other. The bicep attaches on the tuberosity and the brachialis attaches on the coronoid. These are the two movers of the elbow, the bicep and the brachialis. And they both get musculocutaneous. All right, so review the brachial plexus again. Just keep coming back to it over and over again. We did musculocutaneous. We talked about radial. We've mentioned the axillary nerve here, the deltoid and the teres minor. And now we're going to move our way into this area right here, y'all. We're going to start talking about the flexors in the arm and the extensors in the arm, the elbow. And things start to get a little crazy at this point. So I'm going to limit the craziness. I'm going to limit it, and I'm going to do it with some clinical stuff. All right, so first, let's look at these. You did these yesterday in the lab. Most of you were working on these in the lab yesterday. I saw you working on these. And so let's work our way across this thing, talking about the muscles you found in the lab, and I can point out some stuff as we go. All right, so the first one here that some of you damaged in your dissection. On the lateral side, so we'll just work our way across laterally, superficial, and then I'll tear these off and we'll go deep so that I can help you with a clinical thing, the carpal tunnel. All right, so first thing here, the first one here is the brachioradialis. This is a very thin muscle on your cat, and a lot of you cut it. It attaches all the way up here to the distal end of the humerus, so it goes all the way up to the brachium. And its attachment is down the styloid process of the radius. So it runs down on the lateral side here. Your cat's arms are all like this. And so this muscle doesn't even attach to the forearm. It's off of the arm. And a lot of times it's so thin in your dissection you'll cut it. The next one in order here is the pronator teres. The pronator teres contracts. This will be good for our joint actions. The pronator teres contracts, and when it does, it moves the thumbs medially. The head of the humerus will roll in the radial fossa of the ulna when that happens. It rolls in that radial fossa, and these two bones cross each other. It is the function of this muscle, really. This is the reason why the anatomical position is described this way. We don't want the bones crossed when you look at the anatomical position. We want them running parallel. And so the pronator is the one that crosses them, the pronator teres. It is attached to the medial epicondyle of the humerus, the medial epicondyle of the humerus, and the coronoid of the ulna, down to the midshaft of the radius. That's why it's so easy to find on your cat, because on the flexor side, this is the short one in the middle. It's a good orientation muscle. Nobody misses this one. You can find the pronator teres very easily. And so you know when you find the pronator teres that the brachioradialis is on that side and the flexor carporadialis is on the other side. We did this with the also cat yesterday. Okay, so brachioradialis and the pronator teres. This one gets immediate information. Let me make a point here. When you talk about flexion, you're talking about median innervation for the most part. Now, why in this picture, from what you've learned about the brachial plexus nerves, does the brachioradialis give radial information? Can you tell me about the traversing of the radial nerve that would explain this?
Comes into and back.
Yeah, this is an odd phenomenon that the nerve would be responsible for flexion at the elbow and flexion at the wrist. The nerve should be on the back of the arm. The brachioradialis is a flexor muscle. How in the world does it get radial? You see my point? Because you guys know now that the radial nerve actually traverses anteriorly in the cubital fossa, and there it picks up the brachioradialis. I made that point earlier today. The next one in line here is the flexor carpi radialis. The flexor carpi radialis has its attachments on the medial epicondyle of the humerus. Now, make a point here. Wait, stop. Because we'll do this. This will be 2 questions at least on your test, right? If you want to flex, you come from the medial epicondyle of the humerus. If you want to extend, you come from the lateral epicondyle. So you see it? Medial epicondyle of the humerus. Medial epicondyle of the humerus. Medial epicondyle of the humerus. If you want to flex, you come from the medial. If you want to flex, you come from the medial epicondyle of the humerus. All these guys here are attached on the medial side. The medial epicondyle is the major flexion location. The exception being the brachioradialis, and we pointed that out to you. All right, so the next one in line then, the medial epicondylalis, the metacarpals 2 and 3. I put it here. You'll need to know it for your lab exam, but for the lecture test, I'm going to show you the ones I really want you to focus on here. So medial epicondyle to the second and third metacarpal. This one is the palmaris longus, the next one in line, and it gets immediate information. It goes to the palmar aponeurosis. So there is a, if you skin the hand, pull the skin off the hand of the cadaver, you can see this tendon sheet here. And that tendon sheet is actually the tendon, the extension of the palmaris longus. That's where its name comes from. It is your palm sheet. The palmaris longus is the palm sheet here. And you can see that thing comes down and attaches to 2 to 5 here. It doesn't list 2 to 5 here for palmaris longus, but that's the truth. The reason it doesn't list 2 to 5 here, I believe, is because of what we're going to do here on the next picture. with deeper muscles of the forearm. So the palmaris longus to the palm sheath, tear the skin off the palm, that's the palmaris longus there from the medial epicondyle, the palmar aponeurosis. And then the last one, here, the flexor carpi ulnaris. Please don't get this one confused, the flexor carpi ulnaris in the lab with the extensor carpi ulnaris. Nobody mixes up the flexor carpi radialis, but sometimes students will get this one wrong because they're really close to each other. So the simple way to do it is just to find the flexor on the anterior side, the extensor on the posterior side. This one gets ulnar information. Does that make sense from what you know about where the nerves are? So if I'm in my cubital fossa, can you take me across? What would be this one way out here lateral?
Radial.
Radial. What would be the next one?
Medial.
Median. Where would I go to stimulate the ulnar?
The medial.
Here. Yes? Ulnar nerve. And the ulnar nerve picks up here the flexor carpi ulnaris. It goes again from the medial epicondyle to the olecranon. Is that a proximal or distal attachment to this muscle? Proximal or distal? That's a proximal attachment to the pisiform hamate and the fifth metacarpal. All right, now, as I said, medial epicondyle is the big deal here for me. The specific attachments for the muscles in the forearm, I would like for you to know for the purposes of what passes through the carpal tunnel. So that's what this picture is for. You learned the carpals of the hand, yes? So long, top part here comes the thumb. Can you do them with me very quickly? So, scaphoid long. Here. Wait, so long, top. T, top. Triquetrum, yeah. There's 3 T's, right? Triquetrum, so long, top part. Pisiform. Here comes captate. V. Trapezoid. Yeah, it looks like a trapezoid. And the last one? Yeah, because the trapezium goes with the thumb. Yes? Never forget that. The trapezium goes with the thumb. Now, if I tear those muscles off, those superficial muscles, if I tear them off and I work deep into the arm, underneath the brachioradialis, the pronator, the flexor carpi radialis, the palmaris longus, the flexor carpi ulnaris, if I work deep to that, I find the flexor digitorum superficialis here. And this one has, the superficialis has attachments to the medial epicondyle. The flexor digitorum superficialis goes to the medial epicondyle. Everything comes from the medial epicondyle. This muscle then attaches also proximally to the coronoid, and then it goes to the middle phalanges of 2 to 5. Now, what other muscle did you just see that looked like this? You just saw one that looked like it went to 2 to 5, but I didn't describe it that way. I said it goes to the tendon sheath, the palmar aponeurosis. That was the palmaris longus. Okay, so this would be the deep portion of the palmaris longus here at the hand. You have to peel that sheet away. I don't know that you could tell the difference between those if you try to pull that sheet away. But I want you to know 2 to 5 here. I'm going to show you why in just a second. All right, now, if I tear, let's do it on this slide, it doesn't matter. I have it on both pictures. So, if I tear the superficialis off here, the next deep muscle here to the superficialis is called the flexor digitorum profundus. Now, your lab manual did not ask you to know these, the profundus muscles, but there are several heads to this muscle. And you can see that this profundus also has attachments to 2 to 5. But this time out to the distal phalanges. And so in terms of the distal attachments, the superficialis goes to the middle, and the profundus goes all the way out to the ends. Y'all see that? Same attachments. The superficialis to the middle, and the profundus goes all the way out to the ends, to the distal phalanges here. Now this one doesn't actually attach to the medial epicondyle, it has its attachment to the coronoid, but that's shared with the superficialis. So it's a little bit more distal attachment here, the flexor digitorum profundus. Now this is the other muscle. On the brachial plexus slide, I keep showing you this slide over and over again. It says under the ulnar that there are two flexors. Two flexor muscles that are innervated by the ulnar nerve that do flexion. And they are the flexor carpi ulnaris and this one. So the flexor digitorum profundus. It gets ulnar and some medial. There's a couple of heads that get median, but this one, the profundus, does in fact get ulnar information. Notice the superficialis is still median. Okay. And then the last one here on this slide that would be deep here to the superficialis and the profundus is the flexor pollicis longus. And this one has its attachments to the radius and the interosseous membrane and to the distal phalanx thumb, and it gets median information. Now, I realize if you're like me, that this kind of stuff is beginning to just circulate crazy in your head. So I have another picture to look at it here with the exact same things written, and I've got typed on this slide to make the emphasis for memory purposes. I've written on here the emphasis, the attachments of these muscles, the superficialis here, the profundus, and the pollicis longus, in order to emphasize to you the things that are passing through the carpal tunnel. I wanted you to see it. So I just read to you the attachments of these, all of them with the quadratus. But I read to you the superficialis profundus and the flexor pollicis longus, and I've made an issue about the attachments passing to the digits 2 to 5. Now, I have several images of this on the presentation, and we can go through all of them, and hopefully we can do this maybe next Wednesday. I'll go through this one more time, because a lot of people have trouble with their hands and their wrists in this area, and you guys, I think, should know what is there. Okay? So, notice that I've got labeled for you here the tendons of the superficialis and the profundus. Now, I know it just happened, but there's no sense in me just blathering if you're not picking this up. These are the tendons of the superficialis and the profundus. They are found inside the carpal tunnel. This is a picture, this is a cross-section of the wrist here. And over here you can see the transverse carpal ligament over here. And you can see the things that are located within this tunnel of very important information. So the first question I think here is, where is this tunnel? Is it on the anterior side of the hand, or is it on the posterior side of the hand?
Anterior.
It's on the anterior side. Now, from what you've learned so far in class today, how would you have figured that already? Okay, this is the point. Yeah. So when I made the emphasis here to show you that these tendons are attaching to the digits 2 to 5 distally here in the hand, then that was part of the reason here. This is an anterior wrist problem. Okay? Now, does it surprise you then from the attachments that we just saw to see that there are in fact 4 of these? I put 4 arrows, even though the picture you see 1, 2, 3, 4 tendons, and then 1, 2, 3, 4 tendons. Does it surprise you then to see those tendons oriented where they are? The superficialis and the profundus. The superficialis would be superficial to the deeper tendons, which would be part of the profundus. You see that? So if I got on the anterior side, if I got out here on the anterior side of the transverse carpal ligament, what tendon would be there? So if I was doing a dissection of a hand here and a wrist, and I pull this off, the first major tendon that would come across here and fuse with the tendon sheath, the palmar aponeurosis would be the palmaris longus. Yes? And then, if I pull the tendon of the palmaris longus away, then I would have to cut the transverse carpal ligament. And then what four tendons would I find? They're still flexible, but I want to know the muscle name. Mm-hmm. The superficialis, right. So if I cut the transverse carpal ligament, the next four there would be the superficialis tendons. And then just deep to the superficialis tendons, what would I find? The profundus tendons. Where is the nerve in the carpal tunnel in relationship to those tendons? Okay, it is superficial, but where? Where is it in the carpal tunnel?
In superior.
It looks like it's next to superficial.
Okay, yeah, so it's right, it's superficial. But if I'm doing, like, a lot of people have trouble here, and they got to move and they cut and work weight. So I'm just trying to help you see what are they messing around with, and where would you go to find it? The nerve is normally the problem. So where is it? In the tunnel. I see nodding, but help me.
In superior.
Lateral.
Yeah, in this section it shows you that this thing is lateral. Now, from what you know about nerves and stuff, what do you think that nerve is?
The only one.
Does that make sense? Where's it going? Where's that nerve going?
To the
That's the ulnar nerve. You see it? Okay, so we're going to do this again. This is an important spot. We're going to do these forearm muscles one more time, review them, and we'll go through them again on Wednesday next week so you guys can get a better sense of it. I want to do that again because that's hard, and I'd like for you to know about what's going on in the wrist.